Hi, my name is Gabby. I'm a student physical therapist. Is it okay with you if we perform some range of motion measurements today at your shoulder, elbow, and wrist and record them for educational purposes?
Yes.
Alright, so with the patient and sitting, we can perform a couple of motions here at the wrist. So first we're going to do wrist flexion. I'm just going to bring your arm up over here so that your hand is hanging off the edge of the table. For wrist flexion, you're just going to bring your hand down and just keep your fingers relaxed as best you can. I'm going to line up my goniometer. Go ahead and relax. My axis of rotation at the triquetrum, my stationary arm in line with the shaft of the ulna, and my moving arm along the base of the fifth metacarpal. So go ahead and perform that motion for me as far as you can. And we are getting 69 degrees, and normal here is 80. The next one is going to be extension, so we're going to just the opposite way, bring your wrist up. And same landmarks here, relax triquetrum, shaft of ulna, and fifth metacarpal. Go ahead and bring that wrist up as far as you can. And we are getting 61 degrees, and here normal is 70. The next motion we're going to be doing is ulnar and radial deviation. So I'm going to have you bring your arm back, keep that hand flat, go ahead and just relax. And I'm going to, for both of these measurements, my goniometer is going to be lined up at the capitate for my axis of rotation, my stationary arm bisecting the forearm here, and then my moving arm is going to be along the third metacarpal. So for ulnar deviation, you're just going to bring your wrist out towards that pinky side as far as you can. Wowzers. Norm, right here we are getting 61 degrees, and normal is 30, so you have some excessive range of motion there. Next we're going to be doing radial deviation, so same thing except towards the thumb side. I'm going to go ahead and relax. I'm going to line back up my goniometer at the capitate, forearm, and third metacarpal. Go ahead and bring it to the thumb side. Alright, and we are getting 23 degrees, and their normal is 20 degrees. So that's all the ones we'll be doing in sitting. Next, we're going to have you lay on your back, and if you don't mind removing your shirt so I can see all the landmarks on your shoulder, please. Alright, perfect. So the first motion that we're going to be performing is shoulder flexion. So we're just going to have your thumb up towards the sky and bring the arm all the way up as far as you can. Perfect. Go ahead and relax. I'm going to line up my goniometer axis of rotation along the greater tubercle of the humerus. My stationary arm is going to be along the mid-axillary line, and my moving arm is going to be the lateral epicondyle. So go ahead and perform that motion for me. And we are getting 178 degrees. Normal range of motion there is 180 degrees. Next, we're going to be doing shoulder abduction. So palm up and going to be going all the way around as far up as you can. Perfect. Go ahead and relax. And I'm going to line up my goniometer's axis of rotation to the anterior acromion, stationary arm parallel to the sternum, and moving arm again, this time to the medial epicondyle. So go ahead and perform that motion for me again. I'll line up my goniometer. Alright, and we are getting 171 degrees. Normal is 180. Next, we're going to be doing elbow flexion. So I'm just going to put this towel here for now. We're going to have you bring your hand up in flex position. Perfect. Go ahead and relax. I'm going to line up my goniometer, axis of rotation at the lateral epicondyle, my stationary arm up to the acromion, and my moving arm is going to be the radial styloid. So go ahead and perform that motion for me again. Perfect. And we are getting 150 degrees, which is exactly normal. And then for elbow extension is where I'm going to use the towel here to make sure that we can get through that full range of motion and the table's not blocking you. So just start from a flex position. I'm going to line up my goniometer again, axis of rotation at the olecranon, stationary arm up towards the acromion, and my moving arm will be at the radial styloid. So go ahead and perform that motion again for me. Straighten as far as you can. And we are getting 8 degrees. Normal there is 0 degrees of elbow extension. For the next motion, I'm going to have you scoot towards the edge of the table for me a little bit. And I'm going to bring your arm out to 90 degrees. I'm going to support your humerus with the towel there. And we're going to be doing internal and external rotation. So for internal rotation, you're going to bring your hand down towards the table as far as you can without compensating and bringing that shoulder up. So go ahead and relax. I'm going to line up my goniometer axis of rotation at the olecranon process. Stationary arm is going to be perpendicular to the ceiling, and my moving arm is going to be that ulnar styloid process. All right, so go ahead and bring that hand down as far as you can. All right, and we are getting 61 degrees. Normal here for internal rotation is 70 degrees. For the next one, we're going to be doing external rotation, and we're going to have you bring your arm back as far as you can. Perfect. Go ahead and relax. And same landmarks, olecranon process, perpendicular to the ceiling, and ulnar styloid. Go ahead and bring that arm back as far as you can. You do a little bit more, you think? Perfect. All right, and we are getting 79 degrees, and normal there is 90. Thank you.